All right. Well, good morning, everyone. It's another fantastic Monday morning here at Health Plan Markets. It's 9 o'clock, August 12th, 2024. Thank you guys for being here live on the call as we go through all the great things that you need to know in order to be your best self by helping our community. So, how do we do that? We improve the lives of our community with affordable healthcare. Thank you for being a part of that mission. And thank you for being here during these calls. As a reminder, these are being recorded and hosted on YouTube in case you miss one. You can go out there and subscribe. That way, you don't ever miss a call and you know what's going on when it happens. So, with that, as I normally start, I want to make sure that we are up and up on the training this week. We've got quite a bit of training this week, which is somewhat surprising. Maybe not so much training as it is these rollout sessions that are starting to come out for each of our carrier partners, MSOs, and the latter, which is pretty early. Most of the time, we see these types of events in September. But first and foremost, I do want to say if you haven't started your annual certifications or recertifications, please focus on those first, because going to these things, you might be a little lost. So go ahead, get your AHIP done. FFM is out, get that done, and then go through your recertifications for each carrier. If you have any questions about whether or not you're ready to sell for 2025, we're gonna walk through that on how to check some of those things this morning. But you can always send an email to contracting at askhpm.com or support at askhpm.com, and we're happy to help you and find out exactly if you're missing anything or if you need something regarding your certifications. All right, sorry, had a little glitch there. Okay, so with that, let's go through the training. Today, just a little heads up, last Friday was our very own John Minotti's birthday. So if you see him, bump into him, say happy birthday to him. He is now able to have an adult beverage. So congrats, John. Um, Today is Victor's HPM anniversary. He's been with us for quite some time now. So if you bump into him, please congratulate him for making it another year at HPM. We really appreciate everything that he does. All right, later today, we've got AEP Client Retention Survey Overview. This is a Spark training. Those of you that are preparing for AEP, for Medicare specifically, the Spark platform is going to have plenty of training sessions going on this week. The first one is a survey. What happens during AEP? How are your clients getting contacted? It goes through the postcard. It goes through the cadence of these. So each of your members gets a postcard from you with your picture, your name, your phone number on it, so they can contact you in case they need to make any changes. There are deadlines to make sure that this happens. There is no cost. Let me repeat, there is no cost for these campaigns, but you do have to work to get them set up. If you have any questions on this, support at askhpm.com. We will get to you and help you out with that. There is training in the training calendar for the survey. Getting started with Spark. If you haven't gotten started with Spark, that's at 2:30 today. Jump on that. Rollout sessions are happening. We've got two from Devoted. This one's in Orlando today, one at 9 o'clock, or I'm sorry, tomorrow. Tomorrow at 9 o'clock and tomorrow at 1 o'clock at Andretti's Indoor Karting and Game. It is a fun time, let me tell you. I'm always really excited to go there. I will be personally at the 9 o'clock one in case anyone wants to join me, but they also have a 1 o'clock session tomorrow as well. Gold Kidney is also doing their sneak peek. This one's at the Hampton Inn in Orlando at 10 a.m. So I will be jumping over to that one as well because they're making some moves in the Orlando market. So happy to join them there. That's tomorrow at 10. Also tomorrow at 3 o'clock, RSSA, those of you that are interested in becoming a Social Security analyst, it is a fantastic opportunity for you to grow leads. But there's a Social Security wellness training at 3 o'clock. If you're interested in kind of diving into that world and understanding more about Social Security as it relates to Medicare, excuse me, a Social Security expert are hard to find and easy to love. So 3 o'clock tomorrow for that training. Humana's doing a Market Point Partner Summit at 3:30 if you want to join that call on Tuesday. And then Spark has two training sessions tomorrow. The first one's at 1 o'clock. User management. How do you get started with your user management? That's at 1 o'clock. And then we've got onboarding session session 2, leveraging Spark for your business. Let me tell you, these are the tools, these are the trainings that you need in order to be most efficient going into AEP. You don't want to start learning these programs in October, November, December when you're in the midst of, contacting your members, contacting your leads, all the things that you've been working all year round to cultivate. You don't want to be learning systems then. This is the time to learn the systems. You got about 2 months to learn these systems so you can be as efficient as possible going into AEP. And let me tell you, the agents that did this last year are miles ahead of where they were last year. And they will be another mile ahead if they didn't adopt the system now. So I cannot stress this enough. Learning these systems now is going to change your life. I promise you this. Moving on to Wednesday, Ask Al virtual coffee. It's digitized. Bring your own, Joe, if you will. 9:30. He is your ultimate coach, available to answer any questions you have. If you're stuck, if you're lost, if you're confused, like me sometimes. 9:30 on Wednesdays. He's available for you. 2025 vision, which is their forecasting of their benefits. 10 o'clock. You can join that call on Wednesday. Gold Kidney's hosting another rollout session on Wednesday at 10 a.m. That's in Altamont at the Hampton Inn as well. Cigna's got their virtual office sessions. HPM contracting team available at 11 o'clock on Wednesdays for any questions you might have. Thursdays, if you're interested in learning more about the entire industry of Medicare, there is an AEP gut check. A deft research study is being held, or a review of it on Thursday at 11 o'clock. So you can kind of get a feel of what everybody, the experts are saying seniors are going to be doing this AEP. That's going to be a pretty neat one. That's at 11 o'clock on Thursday. Devoted's doing their rollout session at noon in Jacksonville on Thursday. So if you're in that market, check that out. Spark has a couple of trainings. The first one, compliance, at 12 o'clock. Always fun. And then at 1:30, they're going through the Medicare Part D changes. Now, we're going to cover that on another call, but the Medicare Part D changes are really massive for 2025. There are multiple changes, and we need to make sure that you guys know what you're doing out there because it is changing from 2024 to 2025, getting rid of the coverage gap and what that means to your members. Okay, so make sure you're joining calls like that to learn more. HQ, our headquarters for everything to do this business. We are hosting training sessions at 3 o'clock on Thursdays, and then Wilker's doing another vision session at 4 o'clock. And last but not least is HPM Shop. What about HPM Shop? We're going to talk about that this morning. This is our quote and enroll tool for Medicare Advantage, Medicare supplements, all in one. Make sure you're in attendance for those trainings, 9:30 every Friday. If you can't make 9:30 at any Friday, please reach out to us so we can coordinate maybe a call and a one-on-one session for you. So that's a training for the week. Remember, guys, one foot in the classroom and the other one in the field at all times. Jumping over, making sure that I've got my screen. Doesn't look like my screen was shared. There we go. That would help, right? HQ, here we go. So if you don't have access to HQ, remember, you can send us over an email at support@askhpm.com. Go into HQ. You will have access to this. Everything that I just covered in the training is under learning, HPM training. And here is all the events that I just went through for the week. So you can see exactly what's going on as far as training is concerned. So if you're interested in going to that Gold Kidney event tomorrow in Orlando, you just click that and all of the information is there. You can even copy it to your calendar, which is really cool. I like that. All right, let's talk Ready to Sell 2025. Remember, recertification links are under contracting. Recertification 2025, all of the information that you need to get contracted, to get going for 2025. Very happy to see that everything is being loaded here. So thank you to my tech team for getting that done. And we're rolling. Now, if you're concerned about Ready to Sell and making sure that your HPM shop is ready to go, you can go over to Enrollment Tools, HPM Shop, and here we are. So from your dashboard here, once you log into HPM Shop, you're going to go down to, or go up to the top right corner where it says your name, and then you're going to drop down to account overview. And here you're going to have your picture there. So if you see your face, you're in the right place. That's what I like to say. So review all of your contact information. This is what's going to be posted on your personal URL. Your personal URL is a website that is automatically created for you that you can send to members. And you want to make sure that you have your information on there because they may enroll themselves. You get full credit. They may enroll themselves, or they may call you because they got confused. So you want to make sure that you have the right address, phone number, email on there. See, my email's missing here, so I want to fix that. So I'm just going to put 844-696-3975. And I have updated that, and I'm going to click save down at the bottom here, so that way my information is still there. So at the very bottom, you're going to see active selling permissions. And throughout this, you can actually search. There's a little search tool, so you can kind of search for it if you need to. But it's organized by carrier in alphabetical order, and you can also reorganize it by state. So these are all my RTS for Alabama. I can start seeing the carriers on the left side. I can see what plan types I'm good to go, and then plan year 2024. Now, as we're starting to see this, we're probably going to see both 2024 and 2025. It doesn't look like the 2025s are being loaded just yet because the carriers are being very particular about that. But as these things start rolling out at the end of September, you can come back in here and check to ensure that your RTS. I just wanted to show you where this was. You can also make sure that your producer ID is correct for all of the carriers. We have had very, very little issue with this, but we did have a couple of hiccups last year. So just please make sure that your producer ID is loaded correctly. It just takes a few minutes to check it, and you can check it by carrier. All the carriers, once you have, like, for instance, Freedom has several different carriers, but they have the same producer ID. So you have that loaded in there. Okay. So that's how you check your ready to sell status. Again, if you have any questions on that, please let us know, and we're happy to help you with that. Support at askhpm.com. That's what we do. All right. Let's see here. Next on the list, some updates I wanted to share with you guys. There has been some changes in the federal government regarding individual and family plans that I want to make sure everybody is aware of. This is kind of big news. So as part of Biden's reorganization of the healthcare system, one of the last things that is being done right now is the elimination of short-term and tri-term health insurance products. Okay. So to kind of, make this as quick as possible, there has been a notice from the federal government stating that health carriers will no longer be able to offer short-term or tri-term health insurance after September 1st of this year. So after September 1st, these carriers' products will no longer be offered. You can no longer enroll in them because they're trying to push everybody into ACA, or as many people into ACA, into the risk pool, in order to make sure that everything is working like it's supposed to be working in our federal government, as far as that goes. So, so that is what is happening there. What does it mean to you specifically? Some people may go shopping for short-term policies, but they are not going to be able to enroll in those short-term policies as of September 1st. So if you have anybody that you're helping with short-term, now's the time to get that done. After September 1st, those people that are enrolled in short-term and tri-term can remain in that product until the end of that product cycle. Short-term is usually, 12 months. Tri-term is, up to 36 months with the renewal. So at the end of those policies, and depending on where we land in that future, they may or may not be able to re-enroll in those products. Okay. But as of September 1st, you're going to have to choose an ACA product or something else besides short-term and tri-term insurance. Okay, so that is going to be what it is. I want to make sure that you guys were aware of these changes because they are happening across the way. So, all right. So Let me just check the chat here because we got a few questions. Sorry about not sharing my screen. I don't know what happened. I think it glitched. Really appreciate that. Lynn is saying, one of those carriers gave me the impression they could still sell them, but only for 90 days short term. Can anyone enroll in a short term plan for 30 or 90 days, or is it all going to be ACA? So the reason that this law is coming into play right now is because many of these products are undermining the federal government's effort to get people enrolled in full health insurance coverage. Short-term products were designed to be short-term, not as a replacement of the FFM or ACA products or the individual and family plan products. But agents and people are starting to realize, hey, I don't need to enroll in an ACA product. I can go ahead and just do short-term, or I can do a tri-term and I'm covered for 3 years. That wasn't how they were designed or what was needed from the federal government. So this is a problem that is being addressed by the federal government. We don't know exactly what the new designs will be just yet. I do understand the carriers are filing for true short term, like 30, 90 days. But we haven't seen any of those products just yet, so we don't really know. But as it stands right now, you cannot enroll in the short-term products as they're designed today. So after September 1st. So I hope that helps. Can you please repeat the information if we want to know everything about Medicare? It will be this Thursday at 3 o'clock. We have the training calendar. Just as a reminder, please go into HQ. This call is being recorded, so you can check out the YouTube. If you missed the session or if you missed one of the information, I'm not really sure which one you're talking about, but just go ahead and you can shoot over an email to support@askhpm.com and we can get you the information that you might need as far as specifics there. I believe we might have a guest speaker on the line. Do we have, I think we're supposed to have Katie. Is Katie on the line?
You do not have Katie today. This is Justin with Gold Kidney Health Plan, Market Manager for West Florida. How are you, Justin?
Even better, because you have the best name in the business. So
you can't get much better than that, right?
I'm telling you. I was looking for Katie. I didn't see her, so I was giving her some extra time. But no, I'm happy you're here. Thank you for being in there. Justin, I want to quickly introduce Justin from Gold Kidney. He's going to give you the up and up on what's happening for Gold Kidney expansion plans, hopefully, and then any secrets, tricks, tips. And I'm sure he's got ways to make you money. So Justin, can you go ahead and take it away, buddy?
Absolutely. I'm going to share my screen. Is that okay?
Yes, please.
Okay.
Should be at the bottom there with the EV arrow thing pointing up. There you go. I've got your video though.
We good?
I see the Ring Central screen.
Uh-oh. Still Ring.
Yep.
Okay. See here.
All right. So just as a reminder, guys, as Justin's getting, oh, there we go. Perfect. Ready to go.
Okay. Do you guys do you just see the big screen? Is it just one, or do you see two slides?
We see the 2 slides, but that works.
Okay. See here. Is that we still good?
Yeah, we see the full thing. Yep, you're good.
Okay. Again, thank you guys for having me today. I think the last time I got to see a lot of you guys was at the gala that you guys had.
Yeah.
I appreciate you guys having me there. That was a lot of fun. It was very beautiful, and I see a lot of familiar names on the call as well. But I'm really excited for 2025. 2024 was a great year, and really excited to talk about some things in 2025. So Without further ado, I'm going to go ahead and move on to the next slide. So I just wanted to put this disclaimer up. Some of the information that on here, we're going to talk a little. I'm going to have a few minutes of 2024, but a lot of the stuff is 2025, and of course, we can't really talk about with our clients 2025 yet. So make sure that anything that you hear for 2025, you just keep that to yourself and just be all excited about it. I think it's important for everybody on the call, if you have not heard Gold Kidney's story, where we started from, I think it's kind of important, right? You've got a lot of Medicare Advantage plans out there, and to understand why Gold Kidney's here, what Gold Kidney is doing is really important. Gold Kidney was founded and started in Scottsdale, Arizona. Arizona just completed their second AEP, and they're moving on to their third. We just completed our first, and we're already ready for our second. But Gold Kidney was started by over 100 nephrologists and specialists across the country that came together. These providers, they visited the patients every day. Patients obviously expressed their concerns that their health plans weren't meeting their needs, right? Copays, whether it was copays or cost share, not affordable services. They couldn't use, they were used to the 20% for dialysis. They always had multiple hospital stays. Care management was tough to have, and of course the specialty visits. So Gold Kidney, with the thought that we would want to, have low to zero cost for services, we want to make sure that everybody had the right access to care, and make sure those members are actually using the benefits and had the ability to go outside of network, right? That's one of the good things about Gold Kidney, is that our plans are a point of service, and we'll get to that a little bit more here in a minute. But extra benefits built in, I like to say when we talk about our benefits, some benefits that you guys are used to, but our benefits are more in depth. If you get on another call with me or one of my coworkers, managers, you'll see that you have very similar benefits, but we really go in depth and make it a little bit more useful for people, and they tend to love the benefits so far. And of course, care management, right? Gold Kidney was, just like in the name, is here to help people with chronic conditions. You're going to see in a couple minutes, we do specialize in helping people with chronic conditions, but we do have a traditional Medicare Advantage plan and a MA only plan for people with non-chronic conditions. But care management and managing the members' care is one of the most important things we can do, right? We're trying to keep costs down for the member. We're trying to keep costs down for us. We're trying to keep costs down for providers, and we're really trying to slow down the progression of disease. And so that's why Gold Kidney really came together, because there wasn't anything like this. Now I've got 100 slides I could go over, and I'm not going to do that to you guys, but we're in Florida, we're not used to seeing a dialysis plan that offers a $0 dialysis cost share, right? And it wasn't until 2020 where you could go on a Medicare Advantage plan, and what we know as agents, it's always been 20% until Gold Kidney showed up last year. So very, very awesome, interesting things. We do have those chronic plans, but we're really trying to help the whole population. This is our care team, or our sales team in Florida. Katie Strout is the director of the state of Florida. And unfortunately, she couldn't be on the call. I think she was on the last one, Justin, but she's great. She spent the last 10 years with United Healthcare. We've got Ray Gomez, who does the Treasure Coast and the Miami, down to the Miami area. And then you have me here that does the West Florida, Deneria, and the Jacksonville. And then we have our PACER. Now, Justin, what is a PACER? A PACER is a provider and community engagement representative. So the people that are on this call that don't know what the PACERs or who the PACERs are, they're really here to help me when I'm working with brokers, right? So we don't have any captive agents. We work all with brokers. So they're looking for tabletops, looking for community events, senior centers, health fairs, doc talks, anything out in the community that brokers want to work with Gold Kidney or wave the Gold Kidney flag. Dorian and Mario is on the Treasure Coast down to Miami, and Dorian is on the West Coast. So those are the two gentlemen that you would want to work with alongside me. So why Gold Kidney, right? I'm not going to read this entire slide. This slide's got a lot of information on there. I just wanted to point out a few things that I think were interesting to me and may be interesting to you. Some stats about chronic conditions and CKD. CKD, which is also known as chronic kidney disease, is a silent epidemic. I think the most important thing, if you take away from this slide, is to realize that kidney disease is the 10th leading cause of death in the United States. Yes, that's the 10th leading cause. I thought that was a little crazy when I read that. You'll see here in a second, when you're working with your clients, 1 out of 2 people that you're going to meet in our service area most likely have a chronic condition, whether it's diabetes, whether it's a congestive heart failure, some sort of cardiovascular disorder, hypertension. It's that many people. It's a lot more people than you think. And here's our service area. So the counties in blue are where we are now. Our footprint here. We are in Arizona and Florida. We're expanding into 17 more counties between the 2 states for 2025. Florida specifically, we have 1.3 million Medicare eligibles in our 9 counties right now for 2024, and roughly 40 to 50% are qualified for one of our CSNP plans. So it's a high number, right? And then of course we're adding 13 additional counties for 2025. Right, the Treasure Coast there, Osceola and Okeechobee there, all the way down to Miami. Very excited about Miami-Dade. That's going to be its whole little animal. So I'm not sure if anybody does any work in Arizona or other parts of Florida, but you could see where we're expanding to here on this map here. And I encourage you, if you want to check out our provider directory, or if you want to check out our big robust formulary, you can go to goldkidney.com. Click on shop for plans. It's extremely easy. You can use our find a provider tool and check out our provider list. Right now, I know this would be one of my most important questions. How's the provider network? We're right around 16,000 providers in our 9 counties in Florida right now. We're going to be adding more providers as we go into the expansion counties. So the network's growing, right? Network's important to all of us. So the network is absolutely growing. We use Gold Kidneys, has its own network, and we're also part of the multi-plan. So if you were curious, we're also using the multi-plan as well. I wanted to show you a couple names. The name of our plans, they're going to be changing a little bit for 2025, the name of the plans, to be a little bit more recognizable, right? We want to make sure that people understand the plan. So right now we have 6 plans in Florida, and we're going to have a couple more there in Miami. We just haven't released that information yet. But yeah, we have 6 plans in Florida. We specialize in heart, cardiovascular, and diabetes there at the top. We have a lookalike Medi plan. We're the only plan in Florida, or the only carrier in Florida, that has a dialysis plan with a $0 cost share, and a dialysis complete, which is a full Medicaid lookalike. And then we have that traditional Medicare Advantage plan, that's a regular non-chronic plan, and a MA only plan for veterans. And all our plans are HMO point of service, so you can go in and out of network and stay with those in-network costs with no referrals. Yes, that's correct. No referrals for any of our plans. Very awesome. And then I want to talk just a brief minute about 2025, right? Um, in a typical year, I'm not sure, Justin, how much you guys are suggesting. It's usually between 10 and 15% of the people are shopping for new plans. We are expecting that number to be closer to 90% of the people are going to be shopping. So that's your clients, and that's people out there that are looking for a new plan. So, with that being said, Gold Kidney is proud that we actually increased our benefits on all of our plans, if not somewhat stayed stable, right? We did not raise any MOOPs. We did not do any retiering of drugs. We're not adding any drug deductibles. We will continue to have one of the stronger drug robust formularies. We use MedImpact. All our plans will remain a point of service, and that's for all our benefits. I'm not sure if you're familiar with point of service, but this is truly a point of service for all of our benefits. We have on-demand transportation that's not changing, and it's only getting better. We raised our flex allowance, our dental, hearing, and vision, on all of our plans. And I'm excited to say, Justin, that we are actually going to have a cell phone benefit on all our CSNP plans. You don't need Medicaid, but you will be
Amazing.
eligible for unlimited talk, text. I'm sorry?
No, that's amazing.
Yeah, very exciting. So unlimited talk, text, and data, and of course we added a lot more benefits. We still have the companion care, the Papa Pals, and so forth. But I encourage you. I didn't want to go too much into the weeds on the 2025 plans. We do have some product first looks that are happening today and tomorrow, and so forth. But I definitely wanted to share some of the exciting news about that. Just a couple more slides, I promise, and we'll be done. 2025 certifications are out. They went live for us a couple weeks ago. Get on over there if you haven't already. If you ask some of the people that you work with, or some of the people you know on this call, like Rosie, Nick, Holly, and of course, I'll tell you, we're one of the easier ones. It took me about 10 minutes to get the certification done. We know that you guys have to go through AHIP. We know some of the carriers have some extensive certifications, but we made it fairly easy. So please get on over there. You'll not find a carrier in Florida, as I know right now, that has a ESKD plan. So you definitely want to have that in your toolbox. And of course, I'm not sure if you are contracted, then you probably received Gold Kidney's email or my email. We are actually have announced we're continuing the HRA from this year to next year. So the Gold Heart and Diabetes plan and the Medi lookalike. And then that's going to be a $300 HRA for the remainder of this year and for 2025. And a $400 dialysis plan and dialysis Medi lookalike is going to be $400. So we are continuing the HRA movement for 2025. So get on board. And then last but not least, I did want to show you guys the AEP rollouts. We have 9 rollouts across Florida. 3 are going to be on the west coast of Florida, 2 in Jacksonville, and then 4 from the Treasure Coast down to Miami. So please contact your manager. Get with Justin if you haven't got contracted yet. Let's go ahead and get you contracted and get registered for one of our rollouts where we're going to go in depth, and we're going to have some senior leadership there as well, which I'm excited to have. Katie, of course, Justin knows, really great leader. She will be there. And then, of course, our chief growth officer, Lee Cantrell, will be there as well. I'm really excited. I want to thank you for your time, Justin, and I'm going to leave it there.
Awesome. Thanks, man. Hold tight, because I do have a question for you on this. Great presentation. There's questions. Is Gold Kidney only in Florida? No, they're also in Arizona. Just want to make sure that that's clear. The rollout sessions we're posting on our calendar, so make sure you go into HQ, click training, and then you'll see all of the HPM training, including the rollouts. We're going to post them there, so that way you have it. If you're ready to get contracted with Gold Kidney because you like what you saw, please email contracting@askhpm.com and we'll get you rolling. This is going to be a very, very interesting year, and I will say that Gold Kidney has incredible products, and although it seems like a niche, there's quite a few people that qualify for this program. So I'm very, very excited to offer this to all of our clients as well. So Justin, great job. And if I could, because you're becoming very well known out there for helping the brokers, especially from our team. So we really appreciate everything that you're doing for them. I know you're working with some of the crew as well as far as support goes. For those that are new to you and Gold Kidney, you've been around for a while. What would you recommend these guys be doing now, August 12th, preparing for AEP, and then having a fantastic AEP, knowing what you know going into this season? I'm a broker. Justin, help me with Gold Kidney. What do I do?
Sure.
Can you take a minute and kind of talk
Yeah,
these guys through that?
yeah,
Yeah.
absolutely. This year is going to be definitely different than many other years. So, I was a broker not that long ago. This is my first time on this side.
Mhm.
I saw something that Gold Kidney was doing, and I jumped on board because I know it was just a matter of time before the company goes to be a national company. So, my suggestion, first of all, is protect your book of business.
Mhm.
Call and talk to your book of business. I see tremendous opportunity here for agents. You're going to be reaching out to your current clients. I would suggest to your current clients, hey, I'm here. Come back and talk to me if you have any questions. And with that being said, I know you have a neighbor and you have friends that you may have some questions or may not have an agent. Maybe you signed up direct. So this actually
Mhm.
gives you the opportunity when you talk to your clients that you mentioned that, and you say, hey, let's get your clients. Maybe you can get them in a room together, and you can talk about plans. When it comes to Gold Kidney, we know that it's almost between 50 and 60% in our service area are eligible for a chronic plan. So for us,
Mhm.
we're definitely suggesting to look and talk and think CSNP, right? If these people have one of the chronic conditions that are eligible for a chronic plans tend to have better coverage, right? They have more benefits, more recognizable, benefits as well. So it's an opportunity this year. And of course, working with us, we have a person that actually all he does is work in the field with brokers. We have 0 captive agents. So if you're looking to do some tabletops or something, or even a doc talk, whatever it may be, you can reach out to Dorian and I. And people have, you've worked tables before, where you've worked with other carriers, but not too many people, as we are, putting a lot of effort into grassroots, have worked with Gold Kidney. So,
Mhm.
Gold Kidney also brings an opportunity to set up a tabletop and actually bring some people over that never heard of Gold Kidney.
Yeah. Yeah. No, that's amazing. And one thing that I learned that you guys have is, like you were saying with Dorian, the Pacer. Can you let us know the acronym for that, because I don't think everybody's familiar with that. I think it's brilliant.
Yeah. So the PACER is the provider and a community engagement representative.
Awesome.
And that's
Awesome.
literally all he does is work with doctors, providers, and brokers out in the field. Remember, no captive agents at all, and we just try to get you guys in front of your target market.
So what you're saying is they really need to be best friends with your Pacers.
Yes, just like I am. There's so much going on, and
Exactly.
he's responsible for doing close to 50 events a month. Yes, 50
50.
events. 50. Yes,
Wow.
that's his
Wow.
goal every month is 50 events, and he is out there hustling. So he's out there
Right.
working with those senior centers and so forth.
That's fantastic. So, moral of the story, guys, is activity. You heard it from Justin. Obviously the trend right now is you got to get out there and you got to start, working leads now, because if you're going to get to October and you don't have anything in the pipeline, is going to be a very short AEP, especially knowing that 90% of people are going to be looking for a new plan, or at least exploring new plans. It's crazy to think about. So yeah, we hear you on that. We think that it's about the same stats. Everybody's kind of echoing that as well. So Justin, thank you very much for all the information this morning. Thank you for keeping us up to date with Gold Kidney. And yeah, you could tell Katie that she's on the hook for the next one.
Okay. Thank you, guys. I appreciate you guys. You guys have a good day.
You got it. Thanks, buddy. Okay, everyone, that is it. I know we went a little over this morning, but we always have fantastic information. So I really appreciate everyone sticking by and listening to Gold Kidney and our sponsors here. And we really appreciate everyone working hard at helping our community. So with that, everyone have a fantastic week. Go get them, get your search done, go get some leads, set up some events, and make your wildest dreams come true. Hope you have a fantastic week. Thanks, guys.